Dr. Toussaint, one of your biggest innovations, major innovations of ThedaCare is collaborative care. What is that? And can we see that?
Sure. Collaborative care is a process by which all of the team comes together within the first 90 minutes that the patient is admitted to the hospital. That includes the pharmacist, the nurse, the physician, the patient, the patient's family. And what that team does is actually create a single plan of care for that patient's stay that everybody is on the same page with. So the nurse doesn't have a special plan of care versus the doctor versus the pharmacist. They all work together in a collaboration to deliver the best care for the lowest price. And so that's we've found dramatic improvements in quality and in service and cost by having the team all in one room. It sounds simple, but it's something that is actually very difficult to coordinate. And we've been doing this for 2 years and have had results like no medication errors for 2 years and things like that.
So I come in and I'm going to do it, myself. Collaborative care on me. Who's around me? Who do I have? What happens?
So if you're a patient, for example,
Right.
so a trio of folks enter your room, which includes a medication expert called a pharmacist, a nursing expert, an RN, and a physician. And that group of people will actually interview you, examine you, try to figure out what the issues and problems are, and then design a plan of care with you at the center, and you're part of that design. So you're actually asking questions, or your family is if you're too sick to do that. And so they're intimately involved in the process of actually managing your care for this inpatient stay.
Let's go see a team. Dr. Toussaint, how does the collaborative care team work?
Within the first 90 minutes of a patient admission, you will the pharmacist, the physician, the nurse will all enter the room.
We see them coming in now.
We'll all enter the room and with the patient, and in many cases the patient's family. And this team will actually do the exam, ask the questions, develop a care plan actually as a collaborative team, and that's hence the word collaborative care. In the old world, the doc sort of was in their silo, the nurse in their silo, the pharmacist in their silo. In fact, we had the pharmacist downstairs. They weren't even on the floor. In the new world, it's a whole team of people that are really focused on one thing, and that's delivering better care to the patient.
So this is our team. Now, what do you guys do? Dan, what do you?
I'm the pharmacist, and when a patient's admitted, I come in and I'll take their med list, work with their medications, and then when the team's ready to go.
And Nicole?
And then I'm the nurse, and I use the care plan as a map to kind of guide the patient through from admission to discharge, what the plan is and what we're all doing to progress the care.
And I'm the physician, Norma Turk, and I kind of direct the team, introduce myself, make sure that the patient is comfortable and that their immediate needs for pain medicine or nausea are taken care of. We take a history, and the nurse is doing the computer documenting of that live time so that everything is there and accessible. We examine the patient together, go over any abnormal findings, and then as a team we work together to get a plan of care based on what their major problems are, and that either goes in their patient education folder or right up here on the board for them so they can see who's taking care of them, what the major things we are, what tests we have for them, and most of all, when they can get out of here, because everyone wants to know that.
Karen is our patient. What do you, so you come in and you start working together. Is it, care is so impersonal sometimes. You guys work together, obviously, from day in day out. Does it help to be a team together? And as a patient, do you feel better, more secure, that you're getting better care to have a team working at once?
Oh yeah, it's a lot more organized. It cuts down my hospital time by quite a bit now. It gets started right away, which is very important to me. I'm not laying here like I have been in other hospitals or for hours before I've talked to a nurse and then a doctor, and they all come in at separate times, and you're answering questions over and over. As a patient, if you're in pain and you're not feeling well, you're laying there, answering questions is not the easiest thing to do. So they come in, they work together, they put it all together, and it gets started just like that.
Doctor, does it cut down on the amount of time in seeing a patient when you have your whole team at once as opposed to the normal way we see it, which is spread out?
Actually, we spend about the same amount at the bedtime with the patient, But the greatest part is that there are fewer callbacks of things that weren't clear or need to be done again later. And because we're all here at the same time hearing the same story, the patient is only put through all of that process once. Also, we can start from the very get-go, making sure that everything is done in a timely fashion. You know, if they have to have that ultrasound before they go to surgery, the nurse knows that that's a priority. If they need this or that lab test, then we have that started immediately. We also have a system called toll gates, where we actually have automatic steps in the process and say, now, where are we at? What should be done by this time? And if it's not done, then we go about why wasn't it done and looking into the root cause of that and correcting that before that becomes a defect that's passed on to the next shift. So we're thinking from day one, what does this patient need to get them better faster and get them back home again? And so the clock is ticking the entire time that they're here.
So this is fascinating that you have up here. This is the map. So we have the entire team here. We got Dana, Nicole, yourself. You're making a plan of
Absolutely.
action, and you guys will know when you have finished seeing the patient and doctor's got a plan. Y'all know what's going to happen next
Exactly.
in terms of how you're going to routinely care for it and what meds you're going to prescribe. Or
I'm
what
already
therapy.
planning, while they're working on their care plan, I'm already planning how to time the medications out. If they're going to surgery, which ones we have to stop at what time. There's no break in care. It's not a missed piece. It's all continuous.
And most importantly with this board, it's there for the patient and their families to see it's clear, this is what we're doing, and they can follow the plan along with us, because they're the biggest part of the plan.
And Karen, you've been in here before, right?
Yes.
What has your experiences been?
My experience as far as
Well, when you've come, you've had the team around you, they've put a plan together for your treatment on this board, and, you know, did it work for you?
oh, it does, and I know exactly what's going on then, because sometimes you're not thinking straight, and you can, you sleep for a couple hours, you wake up, you're not sure where things are. You look, and it's right there, and they've changed it as it goes. You know exactly where you're at, what meds you're on, when you get to go home, which is one of the more important things.
You've had a blood condition, which means you didn't come once or twice. You've come for many hospital visits.
Yes.
Do you prefer this kind of care as opposed to care you may have gotten at other hospitals that do it the more traditional way?
This has by far been the best change in my health care that I have found. It has done worlds for me to get out of here sooner. It has made my care go a lot easier. My family understands what's going on when my sister comes in, if she was at work. I mean, she's concerned. She looks on that board, and she knows exactly what's going on. And most important in this process is the nursing staff is included in everything. I mean, they're your lifeline. They're there 90% of the time with you, so
And that's
they know.
important to you.
Oh, yeah.
Are you paying more than you would somewhere else?
No, not at all. Actually, probably a little less.
Really? Because some
Yes.
people would say, wow, this care you're getting here is like buying a brand new Mercedes. I mean, it's very personal. It's very...
Yep, you would think, but no, it has not changed. I mean, I've been to different hospitals, like I said, from here to Mayo, because I have a rare condition, but looking at my medical bills from one place to another, there is no change in the cost. In fact, some of it has gone down.
Some would say maybe the national debate on health care should focus on what they're doing here. You think the rest of the country would want this?
I think they could learn a lot from this, yes. I think this is something that would work well for a lot of hospitals out there and a lot of patients.
This is our computer on wheels. This is part of the continuous quality process. You have all your data on the patient available from previous admissions, current admissions, things of that nature. If we are talking with the patient and they enlighten us to a situation, well, I was downstairs and had some work done, we can find that right there. And we can work with it to get our care plan.
So the patient's medical records are online, cutting down on the paper cost.
Yes. The paper and the time going through a chart, digging through, locating all the information. And that really does expedite the process.
Can a patient access their medical record here, or is this just for the team?
Yeah, due to confidentiality, this is just for the team, and we don't open that information to anybody but the staff.
So instead of the doctor coming in, writing a prescription, gives it to the nurse, who gives it to the patient, and then gives it to the pharmacist, this is all done one-stop shopping.
This is one-stop shopping, exactly. And that's one piece of this continuum of care.
And if after evaluating the condition of the patient, you were to say, okay, we need to have angioplasty or, you know, some major procedure, would that go in here as well?
The doctor would have everything placed in here, and yes.
Full range.
It's not broken off into different pieces. It's not fragmented. It's all continuous right there.
Seems efficient. Nicole, this is a nurse server back here. What is that?
Well, prior to collaborative care, nurses were spending up to 3 hours a shift looking for supplies. So we came up with this idea to have the nurse server right in each patient room with all the supplies you need right here. So no longer am I running down the hall to get an IV bag, they're right up here. And similarly, there's all the supplies that we need right in the room. So we're cutting down on time that we're running around looking for things and more time spent directly with the patients with the bedside care.
And there's one of these in every room.
Every room, yes.
Fantastic. So what is this?
So instead of having one central supply cart, this is what pulls out of each patient room. It makes it easy to stock the supplies so that you don't have people coming directly on the inside of the room to supply. They just pull right out, easy to restock. And again, it provides me time that I'm saving running to a central nursing station. It's all located right in here.
And how often do you restock it, or how does that work?
Oh, we're changing it twice a shift.
So these visual tracking centers are present everywhere at ThedaCare in every clinic and every department in the hospital, and they track exactly what you'd see on a Toyota production floor, which is quality, people, service, delivery, and productivity. And what we're doing is measuring performance on a really almost minute-by-minute basis in this clinic in terms of how long it takes to turn to get lab results, for example, or how are we doing on quality performance.